The 5 most used health gadgets in cardiology break rooms, endocrinology clinics, and ICU lockers are all sitting on Amazon and CVS shelves for under $100. None of them is the device your favorite wellness influencer happens to be selling this week. 5 cheap health tech brands everyone ignores, but specialists quietly recommend because the FDA does not allow a $30 medical device to be sold at lower accuracy than a $400 one. By federal law, both have to clear the same 510K pathway. The premium price buys an app, a logo, and a marketing budget. It does not buy more accurate numbers. The brand at number 1 has been the most recommended blood pressure monitor by US doctors and pharmacists for over 50 years. The cheap version is $40. The premium version is $179. Both pass the same American Heart Association validation list. 22 years working bedside between cardiology and endocrinology, I will show you what your Apple Watch cannot. Number 5. Wyze Scale X, an affordable alternative. A patient in pre-diabetes management called me last spring, frustrated. Her Withings Body Plus scale broke after 14 months, and she was about to spend $99 on a replacement. I told her to buy the Wyze Scale X for $34. 6 months later, same daily weight trend, same body fat percentage trend, 11 body metrics instead of Withings 4, and 22 months of battery life instead of 18. Here is the truth nobody at Best Buy will tell you. Both Wyze and Withings use the exact same underlying bioelectrical impedance technology. A 2021 JMIRM health study confirmed that across every consumer scale tested, weight readings are within 0 to 0.3 of a kilogram of true value, and body fat estimates vary 2 to 4 kilograms from gold standard DEXA scans regardless of price tier. The DEXA scan in your radiology department is the only true gold standard. Every bathroom scale, regardless of price, has the same systematic offset from DEXA. What these scales actually measure accurately is daily trends. And for trends, the $34 Wyze does the job that the $150 Withings does. 2 things to verify: weigh at the same time daily, ideally first thing in the morning, and switch to weight-only mode if you are pregnant or have a pacemaker. Number 4. Contour Next One. An endocrinologist I worked with for 11 years had a private rule. When her own father was diagnosed with type 2 diabetes, she did not give him the meter the pharma rep was pushing in her clinic. She handed him a Contour Next One from CVS, $19.99. 6 years later, his A1C is the best it has been since diagnosis. The Contour Next platform is the consistent benchmark endocrinologists use to calibrate continuous glucose monitor patients. The Food and Drug Administration's tightened accuracy requirement is 95% of readings within plus or minus 15% of lab values. The Contour Next One delivers plus or minus 8.4% accuracy compared with lab values, which is nearly twice the federal accuracy requirement. The Institute for Diabetes study in Germany scored it 100% accurate within 15 milligrams per deciliter, 97.5% within 10, and 77% within 5, the second highest score in their entire comparison. It exceeds the ISO 15197:2013 standard, the same standard used in clinical trials. When the specialist trusts the cheap meter against the lab gold standard, you can too. Always use Contour Next test strips with Contour Next meters. Check strip expiration dates and wash your hands before testing, because food residue on fingers, especially fruit, falsely elevates readings. Number 3. The iHealth AirPulse Oximeter. In March 2020, Hospital-grade pulse oximeters were being scalped for $400 on eBay. Patients were panicking. 3 nurse co-workers asked me what to actually buy. I told them iHealth Air, $30 from CVS. 5 years later, 3 of them still own that pulse oximeter. 2 of them used it last month when their kids had RSV. Pulse oximeters all work on the same principle: photoplethysmography. A red and infrared LED transmits light through your fingertip, and a sensor on the other side measures absorption to calculate hemoglobin oxygen saturation. The FDA 510K clearance pathway requires every pulse oximeter to demonstrate accuracy within plus or minus 2% of arterial blood gas readings, the hospital gold standard. The iHealth Air uses the same dual wavelength sensor technology as the $300 hospital tier units. Same federal clearance, same accuracy floor. Buying Masimo for home use is paying for a brand name and an app. The number on the screen is the same. The catch is critical. Avoid any pulse oximeter sold as a fitness tracker or sports device. Those skip the 510K pathway entirely and are not regulated for medical accuracy. Confirm FDA 510K clearance on the packaging. iHealth publishes their K number directly. Cold fingers, dark nail polish, and poor circulation all cause false low readings. Warm your hands before measuring and take 3 readings, then average them. If this kind of breakdown is useful, hit subscribe. I keep these coming. Number 2. KardiaMobile. A board-certified cardiologist I worked under in 2019 pulled out his phone in the middle of a clinic visit, snapped a KardiaMobile to it, pressed his fingers on the pads, and showed his patient her own atrial fibrillation in 30 seconds. She had been having palpitations for months. Her annual electrocardiogram missed it. The KardiaMobile caught it. He handed her his personal device to take home for the weekend. She came back Monday with 5 more recordings, all atrial fibrillation. She is on anticoagulants today. Probably saved her from a stroke. KardiaMobile has been FDA cleared since December 2012. The KardiaMobile 6L is the first ever FDA cleared 6-lead personal electrocardiogram. Compared head-to-head against 12 lead clinical electrocardiograms read by cardiologists, KardiaMobile delivered 92% sensitivity and 95% specificity for atrial fibrillation across 233 patients. That study was published in the American Academy of Family Physicians Journal. A separate study of post-cardiac surgery patients found 100% sensitivity and 97% specificity for atrial fibrillation or flutter. Dr. Eric Topol, founder of the Scripps Research Translational Institute, has personally endorsed it. Dr. Leslie Saxon at USC Keck School of Medicine recommends it. Apple Watch Series 11 with FDA cleared electrocardiogram runs $399. The single-lead KardiaMobile is $79. The KardiaMobile 6L is $129. Both clear the same FDA pathway. Both detect atrial fibrillation at clinical accuracy. The Apple Watch is a watch with an FDA-cleared electrocardiogram built in. The KardiaMobile is an FDA-cleared electrocardiogram without the watch. If you do not need the watch, you do not need to pay for it. Number 1. The Omron Bronze Blood Pressure Monitor. Cardiology Clinic, 2022. A patient walked in with a $179 Omron Platinum he had bought because the salesperson at the pharmacy told him he needed atrial fibrillation detection. He was 41 years old, with no family history of atrial fibrillation and mild hypertension. I told him to return it and get the Omron Bronze for $39. He saved $140 on his very first office visit. That money paid for 2 years of his medication copay. Here is what nobody at the pharmacy will tell you. Omron Healthcare, founded in 1933, is the world's best-selling blood pressure monitor brand, with more than 350 million units sold worldwide. It is the #1 doctor and pharmacist recommended brand in the US for over 50 years. The Omron Bronze at $39 and the Omron Platinum at $179 are clinically equivalent. They both demonstrate the same accuracy under the same federal 510K clearance pathway. They both pass the same ANSI, AAMI, and ISO standard 810602 from 2013 for clinical validation. They both appear on the same American Heart Association validated device list, the list hospitals reference when they purchase. Both use Omron's advanced accuracy technology, the same underlying oscillometric measurement engine. The premium upcharge is for atrial fibrillation screening, which is a screening tool, not a diagnostic. Your doctor will run a real electrocardiogram anyway. It also buys true read averaging, which you can do manually with the Bronze by taking 3 readings, 1 minute apart. It also buys a fancier display. The number that prints on the screen, the systolic, the diastolic, and the pulse, is held to the same federal standard at every price point. The US government does not allow Omron to sell a less accurate monitor at a lower price. It allows them to sell a less feature-loaded monitor. That is the entire price spread. Consumer Reports independently confirmed that the Omron BP 71503 series got top marks for accuracy in their lab testing. The cheaper Omron units perform identically to the expensive ones. There is a 5-year warranty across the entire product line, regardless of price tier. Buy upper arm, never wrist. Confirm the cuff fits your arm circumference. Take readings seated with your back supported, feet flat. Arm at heart level, no talking, after 5 minutes of rest. Take 3 readings, 1 minute apart, and average them. The technique matters more than the meter. One bonus pick worth knowing: Bührer, German engineering, 100-year company history, founded 1919. FDA cleared thermometers, nebulizers, and TENS units, sold at half the price of US brand name equivalents in pharmacy aisles. Especially recommended by physical therapists for TENS units and by pediatricians for thermometers. 5 health gadgets held to the same federal accuracy standard as the premium brands you were told to buy. WiseScale X, with the same BIA technology as Withings. Contour. Next one, the benchmark endocrinologists use to calibrate continuous glucose monitors. iHealth Air, built to the same FDA pulse oximeter standard as the $300 hospital units. KardiaMobile, recommended by Eric Topol and Leslie Saxon, and published in AAFP. And Omron Bronze, the same #1 doctor recommended brand at a quarter of the platinum price. Next time someone tells you a cheap medical device is not accurate enough, ask which FDA pathway they are referencing: the 510K, the PMA, or De Novo. Every device on this list passes FDA review. The premium devices do not pass anything stricter. They just charge more for it. Take it or leave it.